I'll be presenting today on maternal and child health home visiting, a model of healthcare delivery that seeks to prevent adverse health outcomes in mothers and children by providing services and education at home. I'll be looking at a paper examining the role of paraprofessionals in home visiting. Home visitation programs have been in existence for more than 2 decades. States and communities implement these programs to support parents and families with young children. Home visitors address issues such as growth and development, positive parenting practices, safe home environments, and access to services. The goals of home visiting are to empower mothers so they can provide optimal care and ensure interventions across many areas of child well-being. These include health, social interactions, and emotional development. Services are provided to mothers in the comforts of home, which allows home visitors to tailor their services to each client. But do these programs actually work? And under what circumstances do home visitation programs work best? Although the idea makes sense, we still need to evaluate whether the home visitation model is an effective model. Therefore, many program evaluations have been conducted in order to assess child health outcomes after implementation of such programs. I'll be presenting one such review that looks at the effectiveness of home visiting programs. The systematic review I'm presenting is titled Effectiveness of Home Visiting Programs on Child Health Outcomes. This research paper relied on a comprehensive search of electronic databases from 1990 through May of 2012. This paper looked specifically at research evaluating the use of paraprofessionals. Many home visiting programs utilize nurses, but the investigators wanted to specifically assess the efficacy of paraprofessionals. These were trained individuals who do not hold professional titles. After looking at 71 evaluations of home visiting programs, it turns out that most of these studies could not find a measurable improvement in kids. The researchers attribute this to the fact that most of these families who participated were high-risk families that suffered from a wide range of socioeconomic challenges. But it's not all bad news. Although most studies in this paper could not find a measurable difference, there were a total of 21 studies that did. These studies found a reduction in harsh parenting, improved cognition and language, and a reduction in low birth weight. Prevention of child abuse was a major positive outcome in some of the studies. Many studies showed a notable decrease in reports of child abuse. This was due to improved coping strategies of parents and facilitation of positive parent-child interactions. In addition, some studies examined also showed an improvement in child psychomotor and cognitive development due to home visitation programs. Many researchers concluded a noted benefit to using early intervention to improve high-risk children's psychomotor and mental development. In some studies, mothers who received home visits were asked to rate their child's behavior using the Child Behavior Checklist. It was found that those children scored higher in positive behavior than the control group. Therefore, a number of studies were able to find a reduction in problem behaviors in young children that were attributed to home visiting. Some studies noted an improvement in language development. By utilizing picture vocabulary tests, some researchers were also able to assess language development. They found that children who received home visits had more extensive vocabularies and were better able to express themselves. Studies also found that parents who received home visits were more likely to comply with well-child visits. This was assessed by looking at the vaccination compliance of children. It was found that those who received home visits were more likely to be up to date with their immunizations. In addition, children receiving home visits were sometimes more likely to be of normal weight. Researchers noted that the earlier in pregnancy the intervention was initiated, the lower the odds were of the mother having a low birth weight baby. African American women had the greatest reduction in numbers of low birth weight babies. This systematic review of home visiting programs showed that although some programs showed improvements in a number of indicators, not all programs utilizing paraprofessionals were effective. So, what implications do these findings have, and what can we learn from the findings of this study as we move forward? One thing we can learn is that home visiting programs are more effective the earlier they are initiated. The programs that were most effective were the ones that were initiated during the prenatal period. During this period, the home visitors are better able to assess a pregnant woman's health and social support needs. In addition, adequate training of home visitors was identified as a very important component of a successful home visitation program. The paraprofessionals who were more trained were better able to meet the needs of the families that they were serving. Another conclusion is that it's better to focus on one issue rather than trying to address the multiple needs of families. When programs aim to improve a particular issue, such as prevention of child abuse, for instance, the outcomes improved. Therefore, interventions are of greater benefit when targeted rather than trying to make a large number of improvements. The researchers also concluded that no one intervention can meet the needs of every family. Families who receive home visits often have complicated social situations and are of lower socioeconomic status. Therefore, a home visitation program should be part of a bigger system of support and services for socially at risk families. Home visitors can promote healthy behavior and make referrals to needed services, and hopefully, this will improve child health outcomes. This paper reveals that it's important to adequately train home visitors, to start interventions early in the prenatal period, and to focus interventions rather than try to address all problems.